Thought of your community mental health programs came as a pleasant surprise.
Well, it was pleasant. I don't know that it was entirely a surprise. The governor and I hadn't talked about it before his announcement. He's pretty busy these days, and there really isn't time for much of that. However, I have known that for some time the governor has been very interested in the development of community programs. As you may or may not be aware, he served in one of the regional committees that is working on the development of the Community Mental Health Center program for his particular part of the state.
State of Indiana, what state are we in?
I think it's, through the years, has been improving. It's continuing to improve. We have been very careful in our use of the resources available to us. I'm talking now about manpower available to us. We've been trying to improve our collaboration with the community facilities, not to put a burden on them, but just so that we can help them and they can help us. I think the future looks very bright indeed because of the progress we have made. I think our track record is good. I think the future can certainly be good too. Pardon me.
Dr. Sheeley, there was one news release from your office that came to our newsroom today that indicated the picture may not be so rosy regarding personnel. The governor has indicated he would like a 10% reduction in state personnel. And just taking, for example, the Newcastle Hospital, if this were carried through, that would mean a reduction of 24 people.
What's your question?
My question is this, how would this affect, and this is only one hospital, there are some hospitals where it would affect 70, 80 employees. How will this affect the overall mental health program?
Well, obviously, if there are fewer human resources available in an essentially service operation, that is to say where people are the most important thing that the department has to offer, this is going to impose a kind of cutback in operations. However, obviously, we're going to do our best to minimize the impact on the operation and try to continue to strengthen it.
Would this mean that some patients might have to stay in the hospital longer?
Well, shall we say that some patients will stay longer than they would have done had the numbers of people been maintained? Yes, I'm afraid that has to be said.